Good day, everybody. My name is Oliver Wee, and this is Merit Health and Wellness and Washington State University's Diabetic Education presentation. The goal of this program is to share information to our community and to our patients about the devastating effects of diabetes and ways to prevent this disease from developing. Knowledge about this disease is the first step in managing and preventing this from developing. The topic that we will be talking about today will be basic understanding of routine laboratory work. Today, our agenda would be to discuss the following. Number one, the team approach in managing diabetes. Number two, basic labs. And finally, putting it all together. Managing diabetes is not an isolated activity. Your healthcare provider and team are responsible for keeping track of your progress in preventing the development of diabetes. Or, if you have diabetes, they're responsible to managing it. The most important team player in this process is you. You can help your healthcare team by doing the following things when the time comes to obtain your laboratory work. Number one, take time to obtain the necessary lab work. Two, keep trends of the values. Keep them in hand, especially if the office that you're being seen at does not have electronic medical records. Number three, keep us informed about the highs and low values and keep a running log of your lab work. The lab work that your healthcare team requests paints a picture of your overall health and monitoring your response to the use of medication and non-medication interventions that they are using for you. Common lab values that we request are blood sugars and hemoglobin A1C. So, let's talk about blood sugars. Blood sugars checks are ways to assess a person's blood sugar or blood glucose. Blood sugar and blood glucose are the same thing. We learned in the diabetes and food videos that carbohydrates have the greatest impact on our blood sugar levels. Eating causes our blood sugar levels to increase, and doing activities such as fasting, exercising, and using medications tend to lower blood sugar levels. Since taking blood sugar levels varies at certain times of the day and after doing certain activities such as eating and exercising, it is our recommendation to keep a journal that includes the date, the time, the food that you ate, and the activities that you did. Taking a fasting blood sugar level in the morning is also a good indication of how your body processed the food that you consumed the night before. Just a quick reference, 70 to 90 in the morning is awesome and for diabetics on insulin, less than 120 milligrams per deciliter is the goal. In addition to this, the hemoglobin A1C is a 3-month look-back lab work average that the providers request to see how even your blood sugar level has been. You can think of this as the average blood sugar your body is in after 3 months. Our goal is to keep this on the normal range and not above it. Another test that we could run is the glucose and insulin tolerance test. Basically, this is a way that your providers can use to see how your insulin levels, and your blood sugar levels react after the consumption of 75 milligrams of glucose. Your provider will set mutually agreed goals for you. Blood pressure, pulse, temperature, and pain are important to note when meeting with your provider. The goal is to prevent the development of diabetes, and for people with diabetes, it is to control the effects of diabetes in the body. It is important to note that for diabetics, cardiovascular risk goes hand in hand with diabetes risk, so it is important to monitor and track vital signs. I encourage you to discuss with your providers any other medical conditions that you're experiencing. Medical issues such as Crohn's disease, hypothyroidism, hypertension, increased cholesterol in the blood are things that you should discuss with your provider, since these conditions can make managing diabetes or preventing diabetes more difficult. I also encourage you to talk to your providers about your cultural differences with food, body image, and anything that is important to you because this might impact your diabetic care. Make sure that your provider gets to know who you are, what access you have to grocery stores, and if you have to take public transportation uh, to get to the store that you're going to be buying food at. It is important to be honest with your provider about how much alcohol you drink and trust them that they will not shame and judge you for it, but rather this is a need to know in order to manage your diabetes risk. Let your provider know when taking your weight is a negative trigger for you, and maybe you can take on the next visit if you're feeling emotional about it today. Let's take a few moments to take a look at the symptoms of low blood sugar. Has any one of you experienced the symptoms? For the uncontrolled diabetic, if the symptoms is severe, then pure sources of sugar is needed to immediately reverse the problem. Quickly reversing the problem is the key to prevent fainting, falling, and injuring yourselves. Next thing to do is to check the blood sugar level and treat it again if it's still low or the symptoms are still present. It is a good idea to eat something and record the events to talk to your healthcare provider to possibly discuss ways to prevent this episode or for possible medication adjustments. These are some of the things that you could do or take to treat low blood sugar episodes at home. Symptoms of high blood sugar. The symptoms of high blood sugar are very similar to low blood sugars. Please take some time to look at this slide. Or if you can, please pause the video and take a look at this slide. Ways to manage high blood sugars is to check them with a glucometer, use medications, and call the provider that is managing you. Things to ponder. I would like us to think about our personal SMART goal. SMART stands for sustainable, measurable, attainable, realistic, and timely goals that we could set for ourselves. This can be anything we want in regards to the prevention and management of diabetes. An example would be to increase the amount of water we consume in a day. Another example is to incorporate avocados in your diet. Well, this concludes our lab videos, and I want to thank you so much for your time. Please take the time to answer our survey. If you have any questions or concerns, please email Sierra, Lindsay, or Oliver for questions, and we will do our best to help answer your questions. Thanks again.